My name is Annelise and today I'll be showing you an abdominal assessment. Now, as someone in the pre-hospital setting, we don't have quite as much time as to do a full assessment, so we just do more of the basics. If we were to do a full assessment, this would include a close inspection of all extremities. We'll be looking at the hands for any kind of clubbing, which could indicate a kind of bowel disorder. We'll be looking for leukonychia, which could indicate liver failure. We're looking at colonychia, which could indicate an iron deficiency. This is all in your hands, great. We'll then be looking at the arms for any bruising, which could be suggestive of abnormal coagulation. We'll look for any track marks, which would be due to drug use. We'll look at the eyes and get the patient to lower one of the eyelids. We could check for jaundice, check for any kind of anemia, check for xanthelasma. We'll look in the mouth for any ulcers, which could indicate Crohn's or celiac disease. We'll look at the tongue to see if there's any swelling of the tongue, which could be associated with iron or B12 deficiencies. We'll look at the neck for any cervical lymph nodes, which could indicate infection or a malignancy. We'll look at the chest for any spider navi, which could indicate chronic liver disease, and would note any hair loss, which could be indicative of malnourishment or iron deficiency anemia. We'll do a more closer inspection of the abdomen, which would include looking for things like scars from any appendectomies, colostomies, laparotomies, etc. We'll look for any masses, kind of assess the size, the position, the consistency, etc. of them. Look for Cullen's sign, which is the bruising around the umbilicus region. We'll look for the Gray-Turner's side, bruising around the flanks. We'll look for any abdominal distension, which could be fluid, fat, feces, etc. We'll look for any striae to do with the abdominal distension. We'll look for caput medusae, which is portal hypertension. And we'll look for stomas relating to a colostomy, alostomy, urostomy, etc. So without further ado, here is my abdominal assessment. Hi there, I'm Annelise with the ambulance service. Can you tell me your name and date of birth, please?
Kat Knowles, 2nd of the 10th, 1993.
Cool. Today I'll be performing a full abdominal assessment on you, which will require you to remove your top and I'll feel around your tummy a bit. Is that okay with you?
Yeah.
Cool, so if I can get you to take that off now and I'll lower you down a bit and we'll get started.
Cool.
First we're going to start with a light palpation. This is checking for any tenderness, rebound tenderness, guarding or masses. So we're going to palpate each quadrant separately and we're going to check the patient's face to see if they're in any pain at any point. So after the light palpation, we move on to deep palpations, starting with the liver and the RIF. Moving up the right side to check the liver completely. If we find any masses, we'll take note of the size, location, mobility. Then moving on to the gallbladder, which is in the right costal margin. And we'll get the patient to take some deep breaths as we're palpating. If they stop inhaling at any point, they're in pain, we need to stop. So next we palpate the spleen. Deep breaths, please. If we're able to feel this, it's at least 3 times its normal size. After the spleen, we're going to move on to the kidneys. So we put one hand behind the patient, one on top, and ask for deep breaths again. And then we're going to check the aorta. We're also going to check the appendix to see if there's any pain in there. After palpation comes percussion. We're going to start with the liver at the RIF. 2 fingers and listen for any dull sounds. Moving up the right side. Next we're going to palpate the spleen, so we'll start in the RIF and move our way around to the left upper quadrant. Then we're going to check for shifting dullness just around the abdomen. Once we've done percussion, we're then going to auscultate the abdomen. So we're checking the vowel sounds, looking for any gurgling. Gurgling is normal, tinkling is not, and any absent vowel sounds is not a good sign. I can hear some gurgling, so that's fine. I'm going to check the bruits. And that all sounds normal. So the abdomen was soft and tender, which is normal, and there was gurgling sounds in the vowel, which is also normal. According to the St. John Clinical Guidelines, red flags for abdominal pain include severe pain, abnormal vital signs, pain that radiates to the back, any loin or flank pain, a temperature greater than 38 degrees Celsius, any female aged between 15 and 40 that's last known period was more than 4 weeks ago, anyone who is pregnant, any abdominal tenderness, any pain made worse by movement, any indigestion, or any repeated vomiting.